we have two sets of patients coming to us. One, which were already on a conventional allopathic medicines who seek homeopathy, and as your reputation grows, you have patients directly approaching you without starting allopathic medicines for homeopathy. Now for those patients who have been on allopathic medicines, when you start homeopathy, the dependence of the allopathic medicines and the withdrawal should be phasic. So what I generally do in my practice is, I do not ask them to withdraw their allopathic medicine instantly. We start the patient on the homeopathic treatment by doing the investigations at the time when you start the treatment. Slowly as your homeopathic medicine starts working, there is a change in the physiology for good. If a patient on hypo starts getting into hyper, that is the time you need to taper the dose of the allopathic medicine. So as the hypo patient goes into hyper, we go on reducing the dose, or the endocrinologist himself reduces the dose, and slowly the patient is off the allopathic medicine. For you or for everybody, it is very important that you are following up this patient regularly. If the patient is not regular with the treatment and the patient stops homeopathic treatment instantly, there is a chance that you may have a relapse. So it is very important to tell the patient that you need not stop homeopathic medicine also till the time we tell you. It is mandatory or maybe like compulsory that you observe your patient for more than a year, investigate him every 6 months to see that the readings have stayed normal without taking allopathic medicine, and that's the time you can ask the patient to discontinue homeopathy. Neglected part in homeopathy and for a new homeopath is the use of investigations in treatment of a pathological condition. Discussed in detail how to use investigations in treating a thyroid condition. What is the significance of understanding TCH, free T34, free T3, and when to do your TPO antibodies, or when it is raised, what it means. This is to be completely known to all people who are treating thyroid related disorders, and especially when thyroid related disorders are along with polycystic ovarian disease in females. That time even it is very important to know the hormonal cycle of the female's menstrual cycle, because these are the other hormones which are going to get intermingled in their thyroid related conditions. And I wish that each and every homeopath who wants to treat this effectively and not empirically should know this in detail as much as possible. In fact, I have tried and made myself explain this in the lectures ahead, how to use this, and I feel that if you watch the lectures ahead, it will be very clear for you how to use the thyroid related conditions, the investigations in modifying or modulating your prescription, and understanding the basic core of homeopathic medicine as well as the use of sarcodes. The homeopathic medicine is to be prescribed on the as a homeopathic simillimum, and the sarcode has to be prescribed as a simillimum of the situation when it demands for. So this is very tricky, but it is very interesting as well as it is very rewarding if you can understand this in its core. Another important aspect, that is posology. Now if you understand that in the whole case paper we are looking for a thyroid specific remedy which will be prescribed on the peculiar symptoms to be a simillimum to the thyroid condition. Apart from that, this is no method where we are going to replace the constitutional treatment. The conventional mode of case taking still remains the same. For example, if a patient who is constitutionally staphysagria will obviously receive staphysagria. If staphysagria is doing its job of getting the patient's thyroid related symptoms back to normal, then you need not do this. But out of my experience I have found that many a times the constitutional remedy works for some time, and after that it ceases to have any effect on the constitution, because there are some blocks, and the blocks can be the hormonal block, the endocrinal block, or the block due to taking a lot of allopathic medicines at that time, the medicinal block. So how to overcome this? Now once you go through the case paper which I have told you, and you come to the thyroid specific remedy, which is more on its action to the thyroid rather than as a simillimum to the constitution, you are going to choose this remedy as your thyroid specific remedy. So first thing that each and every student needs to do is to give the conventional constitutional remedy and wait for a situation, for an indication for this smaller remedy. Once you give the smaller remedy to the patient, that is the time you generally see a change much faster than what we were doing by only the conventional mode of prescribing. But when you are prescribing your constitutional remedy, you need to prescribe in the potency which is for the constitution. If the patient is emotional and if the case is at the emotional level, you may prescribe 30 or 200. If the patient is at the level of experience and he experiences this reality as a deep part of his success and affection, and is able to relate each and every symptom at that time, then you can prescribe that as a constitutional in a higher potency. So your constitutional prescribing remains in the same way that you were doing it before. What actually changes is the prescription of your pathological simillimum. Now the pathological simillimum, to my understanding, works on the pathology. So it needs to have some amount of a drug substance within it. Because as you know that if you are diluting the substance more than 13 times, the substance ceases to exist. So for this, I said that let us choose for a remedy which will have some amount of the substance in its physical form, so that the pathological prescription is actually touching the pathology, because it has a pathological remedy within and it has not gone to the dynamicity. So generally for all patients of thyroid, we choose the X potencies right from 2x, 3x till 6x, 12x. If these potencies are used, then we see the reversals much faster. Because as it is, you are going to prescribe on a pathological simillimum, so it is better that you give the remedy in its pathological form rather than the potentized form. Is the management of follow-ups. We all do the first remedy prescription very well, very confidently, but the follow-ups and what to see in a follow-up and when to change a remedy is a very important aspect of any clinician. And everybody has their own way of prescribing remedies and doing a follow-ups. But since I have tried to make this into a system, we have tried to systemize the follow-ups too. Of course, this will be dealt in detail in the lectures and with cases, so you can see in how and which cases we needed a change and what justified the change. The best principle for changing the remedy is change is an indication for change. When the indications change, we always see an obvious picture coming up. It is for a physician to be alert to see this thing and not just deny those indications the way we were doing with the conventional mode of case taking. So first you give what is predominant. When you take the case, as I told you, the conventional mode of case taking doesn't go out of practice. We are always going to do the case on the conventional mode of case taking and then subject the patient to the new thyroid specific questionnaire. So when you take the case, you have to see what is the thing that is predominating in the case, and generally it mostly is the constitution. So the first remedy generally goes is the remedy of the individual, the constitutional, or whatever we may call the individual remedy. And when you are prescribing the individual remedy, you will always have something that is there as a residual in symptoms. For example, when we deal with any cases which has endocrine problem, I must have mentioned to you before, but it is always so that there is a symptomatic picture over the original constitution. Means there is a constitution that is overlapping the constitution. So generally we see a constitutional picture and on that we see the superimposed endocrinal picture. So if the constitutional picture predominates, I have already given the constitutional remedy. But you will now see the picture of the endocrine that is starkly present. Now this is the time when you need to prescribe the remedy for the symptoms that you are seeing, which are residual left of the constitutional symptoms. So generally it comes maybe 15-20 days or a month after you have prescribed your constitutional remedy. You can see the thyroid specific symptoms coming up. So you prescribe the remedy at that time. After that is over, generally those symptoms which have indicated the change, they disappear, and you have to wait till a new set of symptoms appear. The new set of symptoms generally appear which may be coincidental to the CPS timeline. As we all know what a CPS timeline is, as what is mentioned by Dr. Burnett and in the previous lectures before. If you see in the CPS timeline, if it is the anti-miasmatic remedy that is required, you prescribe the anti-miasmatic remedy, or if it is a specific remedy required as a blockbuster you required, so you prescribe that remedy. If it is not, then you have to continue with your constitutional remedy when indicated. So as a series of change occurs, you can see in some of the cases which I have demonstrated that a patient may require one or two or maybe many more than two remedies to come to your normal individual constitution with no thyroid state present. So it is not always at one remedy that covers the patient, it may be two or three, but every time you change, you are changing with a specific indication and not empirically. Ideally, the referring of books for thyroid I have already done, and it is all compiled in my book Conquering Thyroid with Homeopathy, where I have used the specific clinical books which have been from the old literature, specifically Dr. Borick's Materia Medica, Dr. Fatak's, Dr. Allen's, Dr. Farrington, Dr. Clark, Dr. N.M. Chaudhary, Dr. Kent, all these old Materia Medicas which have given cases and remedies for thyroid related disorders have been compiled in one part of my book, that is the Materia Medica section, and with their clinical indications. And mind you, those books which refer only those remedies which have been proved in as a clinically efficient remedy, those are the books which we have taken for consideration. So these books you can refer individually, or you can see the compilation of these remedies in my book which is about to follow. And the indications that I have taken in the Materia Medica are something which are very, very objective, which are very specific, which when referred anytime will give you that information which is not open to interpretation. So once you get an indication of the remedy after taking the case paper of thyroid which I have mentioned before, and when putting it to the repertory, and if you see this remedy popping up, you just go to the Materia Medica section of the same book and read that remedy and see what about that remedy matches the symptoms of your patient. If the entire picture matches, you can might as well give this remedy and see for yourself the results. So basically I use the old literature combined together with the modern knowledge of SAR codes, which is taken from Julian's and Dr. Ghosh. This together will help you to come to understanding of the remedies better. Me to answer this question, scope of homeopathy for thyroid issues? Yes, definitely we have a lot of scope now. After this systemic approach which I have now discovered, or maybe made it into a system, now we can handle most of the cases related to thyroid very effectively, especially hypothyroidism and goiter. These are the cases which come to us very often, and such cases did not have an answer earlier because we were very patchy in getting results. And the most commonly which you will see, or which everybody nowadays sees in their practice, is thyroid related with PCOS leading to infertility and many other feminine disorders. These conditions were also not treated effectively, but with this specific approach, and to tell you in advance that I have a specific approach for PCOS too. And if you can understand the PCOS approach with the same specificity of thyroid combined together, the results have been exhilaratingly good. So no longer are we now depending on our conventional way, but we are now evidence based in our prescription step by step towards treating this condition more effectively than what we were doing before, as regard to what I am seeing in my practice. And I am very eager to share this with you and the whole team of yours, so that we can make this viral and see to it that the whole world is out of this. And you should give me the feedback so that we can improve on this and maybe add to this and take this much ahead towards a thyroid disorder free generation. What this course is all about and what I intend to share from this course, or who are those people who will get benefited from this course, I feel it is for all people who are practicing homeopathy. Because the whole thing which I am sharing with you is a kind of research which I have done for so many years now to understand thyroid. And it will be helpful for anybody and everybody who is actually dealing with such cases. If you see the course, this has been divided into a series of lectures where I speak about the physiology and the pathology of the remedy, which will be helpful for the younger generations who just read thyroid in terms of investigations and do not understand in correlation to the patient's condition. So how to correlate the patient's condition with the present investigation is a topic that I have dealt, so that it will be helpful to the younger generation of homeopaths. Then as we go to this thyroid specific questionnaire which I am talking about, and which is the basic discovery for me at this time, this is going to help each and every person, because this questionnaire is out of a research of all those remedies which we have never dealt before and we did not have a pathway. So it is going to give you a pathway to these remedies, and it is not thyroid specific remedies. Basically they are thyroid individual remedies. That is what I understood after I understood these remedies in detail. It is not seeing the remedy as a part, but it is to see a remedy as a whole. And these remedies are understood with different books. Means it is the extract from Fatak, Boric, Allen, Farrington, Clark, Kent, and all those many great teachers who have used these remedies efficaciously. So basically the questionnaire is the main backbone of this process, and it doesn't exist nowhere now, till my knowledge, where you have a thyroid specific questionnaire to understand the basic of the thyroid situation in any individual. So many things which were not known to us will get known when you go through this questionnaire. So now it has become a must for me and my team that if we are dealing with thyroid, then you need to have a patient to answer this question so that you don't miss. And this used to be a tragedy to us many years ago, that there was no pathway to understand these lesser known remedies. So the questionnaire. After you go through the questionnaire, you come to a series of positive findings of your patient which have been coming to the questionnaire, maybe 5 or 6 important aspects which would have naturally missed in your case taking. Now this 5 or 6 things which you would have missed are those peculiar things which point out to the remedy. Now what you do to the remedy, to those 5 things? You put it to the repertory. Now this repertory which I have designed will help us to understand this remedy now not only as a single symptom, but a remedy as a whole. Now this remedy, now what to do with this remedy? Many a times we used to have this remedy and some one-liner has been written in some materia medica somewhere which doesn't give us the whole picture of the remedy. So what I have done is I have compiled it into a materia medica in my book, and I am discussing some part of this materia medica in my lectures ahead. So this materia medica which I am going to discuss in the lectures ahead is a thyroid specific materia medica of that remedy, which you may now confirm in your patient when you ask the patient about that remedy, about that condition. So it has the questionnaire, it has the repertory, and it has the materia medica. Now to add to this, we have many cases. See, we have simple cases of hypothyroidism, we have simple cases of hyperthyroidism and goiter, which are straightforward cases which did not do well and then required this approach. There are many cases which has other clinical conditions associated with it, Many times we see patients who are having rheumatism associated with thyroid condition. Now what to do? It is many times possible that you treat a rheumatism and thyroid condition stays the same way. Or you treat the thyroid condition and the rheumatism springs up in between. What to do? So how to use this approach in conjunction with different pathological conditions existing at the same time. The next comes is if there are 2 or 3 endocrine conditions existing at the same time, like for example PCOS and Parkinsonism or any other endocrine condition. Now you may see 2 or 3 pictures at the same time. So what to do in such cases? So this approach can be applied not only in a straightforward case of hypothyroidism but different clinical conditions associated with hypothyroidism. So all examples of such types of cases have been a part of this course. Now who it will help? I guess it will help each and every practitioner, one, and it will help the whole generation of homeopaths next, I guess. And I wish that we should go through this as a newer attempt to conquer thyroid. I don't say it is completely complete thing, but what I like to tell you and this generation and the today's practitioner that there is a slight breakthrough in understanding thyroid, and it is going and making lot of changes in my practice. What was not before possible is now possible much faster in my practice, and I am really excited to share this with you all. And once you go through it, I would love that you give me a feedback so that we can together make this process more sharper, more better.